Thank you everyone for attending the Stanford Political Union speaker event today on Healthcare in America, Crisis, Reform, and the Future. We are honored to host Secretary Xavier Becerra. We will begin with a 5-minute address from Secretary Becerra, followed by a moderated discussion before opening it up to all of you for a Q&A. So Secretary Becerra was born and raised in Sacramento, California. After graduating high school, Secretary Becerra studied abroad at the University of Salamanca in Spain before attending Stanford. He earned his BA in economics at Stanford in 1980 and his JD from Stanford Law School in 1984, becoming the first in his family to graduate from college. In 1992, he was elected to the U.S. House of Representatives and went on to serve 24 years on Capitol Hill representing California's 34th District. Then in December 2016, Secretary Becerra became the Attorney General of California. As Attorney General, Secretary Becerra successfully defended policies such as DACA and the Affordable Care Act before the United States Supreme Court and filed over 100 lawsuits against the Trump administration focusing on environmental and healthcare issues. In 2021, Secretary Becerra was nominated by President Joe Biden to serve as the U.S. Secretary of the Department of Health and Human Services. During his tenure, Secretary Becerra oversaw the nation's COVID-19 response and worked to expand access to Medicaid and reproductive health care. Please join me in welcoming Secretary Becerra back to Stanford.
Colin, thank you very much. Yu-Ching, thank you very much. I enjoyed everything that Yu-Ching said except the part about whether you disagree or detest. Hopefully it's no more than disagree. We could talk later if you detest. It is great to be back. It's always good to be back. I have an opportunity to come periodically. Carolina, who's here, my wife, she's a physician, Dr. Reyes, and I both went here. She's 1 year after me, and obviously we got married, so we had a pretty good undergraduate time. And so hopefully 4 years as undergrads and any time as graduate students goes well also. Let me be brief because I know we want to get to some questions and just mention a few things. Obviously things change over the years. There are a whole bunch of buildings in this campus that weren't around when Carolina and I were attending. The politics was very different in those days. By the way, when I bought my first house in 1987, I was able to get a really good interest rate at 9.1%. And that's because a few years before that, people were paying 17% for their mortgages. And so I know that 7% is high for a lot of folks shopping for a home, but there have been different days. Right now, we've got a home where the interest rate is 2.25%. So go figure. You're going to get to experience all those things. I think perhaps one of the most important things I can say to you is what a teaching moment you're in, especially if you're a political science, economics major, someone who cares about governance. You're going to get to see things that many of us rarely get to see, or maybe have to wait till we're a little older to experience. This is not a normal time. Certainly not in Washington, D.C. It's not a normal time. And I hope that you treat this as what it is. It's a teaching moment, but on steroids. Because I don't believe we can go through this very often, not a democracy, and survive well. And so take advantage, learn, because you're going to be out there. You're going to be coming back to Stanford after a couple of decades and talking to folks, and you'll be able to talk about the things that you got to experience. But I guarantee you, you will look at this time period and say, we may never see that again. And hopefully we don't, in my opinion. I would say a couple of other things. I was not expecting to be Secretary of Health and Human Services. I had told the administration, I told the president, really not interested. I'm enjoying my gig as AG in California. But when they offered HHS, my chief of staff, who was with me in Congress and is Attorney General, and was my chief of staff for 4 years when I was secretary, he's a pro at healthcare. He's got everything you need to understand this stuff. And we both looked at each other and said, you know, we took the Affordable Care Act all the way to the Supreme Court, won. We did battle on a number of other health issues, principally reproductive rights, freedoms and protections for LGBTQ. And we thought, what a chance now to actually be in the place that we had to sue so often. And so it turned out to be a great ride. Today, there are more Americans who have health coverage than ever in the history of the country. We boosted the number beyond 300 million. That's never been done before. One of the reasons we had such success is we boosted the Affordable Care Act marketplace coverage, doubled it over what the previous administration had done. They were at 12 million. Actually, they dipped below 12 million people. We're over 24 million today. Most of you can feel comfortable. Some of you still have masks on and protect, but you can go around town and you can do things. 4 years ago, you couldn't do that very well, if you recall. In fact, a little bit more than 4 years ago, when then Joe Biden got sworn in, that day where he got the keys to the White House, essentially 10 jumbo jets went down and killed everybody on board. Because that's about the number of people who died on January 20th, 2021 from COVID in one day. And that was happening every day. Nearly 700 million COVID vaccine shots later, we're in a much better place. We started 988. I hope some of you haven't heard of it because you don't have to worry. Some of you have probably heard of it, and I hope you will let friends and relatives know that if they need help with a mental health crisis, they now can dial 3 digits, not 10 digits based on the region you're in, and you'll get help. You won't be put on hold. You won't get a busy signal. That we launched. Today, there are fewer people dying of overdoses and of suicide than when we took office. And so we've had a chance to do some great things. We've had a great ride, and we're not interested in seeing it change. And so lots to do. I would urge you all to be very intentional in the way you do it, but certainly learn from this moment in time you're in, because you will not see something like this again so long as the Constitution and our laws hold up. If the judges and generals do their job, we'll be okay. Let me stop there.
Great. Thank you so much. So now we're going to move into a moderated discussion. So I'm going to ask Secretary Becerra a few questions, and then after that, we'll open it up to the audience. So to start things off, you were named by President Biden as the Secretary of the Department of Health and Human Services at the beginning of 2021, in the midst of the COVID-19 pandemic. How did the HHS tackle the pandemic under your leadership? What were the priorities and challenges of the response, and in what ways did it differ from your predecessor's approach?
First, we allowed the science to take us where we needed to go. And by then we were beginning to collect enough data, enough evidence to tell us whether the science was ringing true. And so when we saw the vaccines coming out and they were showing success, we pushed. And I think what we did that was special is usually there are pockets in America that are always left behind. Impoverished communities, communities that are rural. We didn't wait for folks to come to us to get the vaccine. Some people have to work 2 jobs. Some people have kids. Some people don't have transportation. And their life is too busy. It's too deep in all their personal concerns that they don't get to do what some of us will make sure we do. And so we went to where they were. And the reason we were able to put some 700 million vaccine shots into the arms of Americans was because we didn't wait for folks to come to us. We went to them. When I got into the position, I got sworn in mid-March. By April, May, we started to see what we always see in this country. Some groups were getting vaccinated at high rates. White American adults had already, by that time, mid-year, already about 60% had gotten their first vaccine. Black and Latino adults, less than 50%. So we were beginning to already see what always happens in this country. And we said, we're not going to let that happen. So we went to where they were. And by the end of the year, more than 90% of white adults had gotten their first, at least one vaccine. By the end of 2021, more than 90% of black adults had gotten their first vaccine. By the end of that year, more than 90% of Latino, 90% of Asian American, Native Americans. We had erased the disparity that existed simply because we went to where they were. I will also say, we also never charged 1 penny for this vaccine. At any point during our administration, we never once charged a single person. And we didn't care about your income, your zip code, or your status.
Great, thanks. Moving forward, in 2 weeks, we'll be hosting Professor Scott Atlas for a talk. As you may know, Professor Atlas has been critical of the government's response to the pandemic, expressing skepticism towards masking and preventing the spread of COVID, as well as towards enacting widespread lockdowns and testing, and recommended instead to limit these measures only to high-risk populations. Atlas was censured by Stanford's Faculty Senate for promoting a view of COVID-19 that contradicts medical science and for behavior that was contradictory to our community, our values, and our belief that we should use knowledge for good. First, what do you think of Atlas's views on the pandemic? And second, what do you think is the implication of academic freedom versus misinformation in this circumstance?
You know, the beauty of this country, and again, during this teaching moment, is to recognize that our Constitution allows for a variety of views, and you get to express them in so many different ways. And we're supposed to protect your right to express those views. In fact, I did as Attorney General on many occasions. But views, opinions are not facts. Everyone's entitled to their opinions. You're not entitled to your own facts. And that's where I would break with anyone who tries to parlay their opinion and treat it like fact. And unfortunately, with the rapidity of and intensity of social media and the ability to communicate instantaneously around the world, oftentimes what is view or opinion is represented as fact. And that hurts. It hurts. I know the difference between someone who says to me, I'm not getting that vaccine because I'm not interested in having some electronic chip put in my blood system, versus someone who says, I'm not getting that vaccine because when you all peddled that about 50, 60 years ago in my community, and those folks in Tuskegee, is it Alabama, Mississippi, were approached, it was because you were letting them get syphilis, and you were using them as guinea pigs to test out what could work to treat syphilis. So there are a lot of reasons for skepticism. Some are based on fact, some are based on opinion. Especially a medical scientist should understand it should be against the Hippocratic Oath to peddle opinion as fact.
Thank you. So more recently, much controversy has surrounded President Trump's selection of Robert F. Kennedy Jr. to lead the HHS, which he was confirmed just this morning, and Stanford Professor of Health Policy Jay Bhattacharya to head up the NIH. As the outgoing HHS Secretary, what are your thoughts on Trump's selections, and how will they impact the future of healthcare in America?
Well, I'm actually outgone, right? So I'm out. What I will tell you is I got criticized because I wasn't a physician when I became secretary. Look, you're essentially running, actually you are running the largest federal agency in the country. Actually, you're running the largest agency in the world if you're the Secretary of Health and Human Services. Actually, you're running the agency, the entity with probably about the 7th largest budget in the world. Not 7th largest healthcare budget, the 7th largest budget. There are only about 6, maybe 7 countries that have larger budgets, including the US, than the Department of Health and Human Services has. So it's a big place. So what I would say to anybody, regardless of their views, again, you get to have your views, is you better know how to execute. Because avian flu is coming around the corner, just the way we had COVID. And you never know when the next natural disaster is going to hit. And you never know when the cyber attack is coming, the way we saw it last year, where virtually 2/3 of the health sector went down because of the cyber attack against Change Healthcare. And they are the ones that process all those bills that providers send to insurers. And they're the ones that communicate private medical data with different providers. When they went down, all that went down. You just better be ready. So I would say to the person who's going to run the 7th largest budget in the world, I don't care who you are, execute.
So last week, the NIH announced that the agency will cap federal funding for indirect costs at 15%. For Stanford, this would mean losing $160 million per year in funding towards biomedical research. How do you think this development would affect medical care, biomedical research, and public health in America?
I mean, you all know the value of biomedical research. We are the birth of so much of that science. We are the place where so much of that becomes actual invention and therapy and treatment. A dollar delayed is medical treatment delayed. So what I can simply tell you is there are a lot of very capable scientists who prove that they've got some good ideas, who are doing some phenomenal research, and to just cut it off, I don't know on what basis. It doesn't seem to me to be moving the dial in the right direction, but we'll see. I mean, look, there's a lot of talk. I'm more interested in the deeds. And so rather than criticize a lot of this, can this dog hunt? I don't know. It's a lot of bark. Let's see if it can bite.
So according to Gallup data, the percent of Americans that view the CDC favorably fell from 65% pre-COVID to 40% following the pandemic. What are your thoughts on the loss of trust in America's health agencies? And should the government and private sectors address the public disillusionment with our healthcare system?
Yeah, I suspect if you were to look at the populace's opinion, whether it's CDC, your leaders of faith, your government leaders, your teachers, I suspect everybody's at a lower level of approval than in years past. Again, there's so much information that you consume, and so much of that information isn't factual information that it's tough. I don't blame a lot of people who sour on individuals or institutions. Again, that's their right. Except, of course, when they need that help, who do they call? Let me give you a quick example. There are a number of things I knew I'd do as Secretary of Health and Human Services. One of the largest producers of baby formula, Abbott, had an issue at one of its plants, one of its biggest plants. Abbott produced, I think, over a third of all the baby formula that was consumed by American families for their kids. They had to close that plant. The industry, the sector, was not prepared for such a large player to have to close that plant. Now, that's a private sector plant. But who did people come to try to resolve it? Us. Well, they went to the president, and the president came to me, and he said, get that baby formula on the shelves of those grocery stores. So we stepped in, and we started shipping baby formula from all parts of the globe that passed FDA's test for safety. We also started to provide some flexibility to some of Abbott's competitors so they could produce more. And we worked closely with Abbott to try to get its plant back online. But it was on us to do it. Had we not done it, those shelves would have been emptier for a longer period of time. And no one was crucifying Abbott. They were looking at the government to do it. But the government is not in the business of manufacturing, distributing, or selling baby formula until it is. And so you can criticize HHS, the government, CDC, until you need it. And I guarantee you, when CDC tells us there's an outbreak of avian flu in this part of the country, you're going to say, thank God CDC was at work.
I'm also curious as well, given that you're California's former Attorney General, you engaged in many lawsuits with the Trump administration the first time around. Now, it's his second administration. I'm curious, Governor Newsom has talked about Trump-proofing the state, and we're expecting a lot more legal battles. I'm curious your perspective on those heading into the second term, and some of your experiences from that, the first time around.
This is the interesting moment where you get to see things that don't typically happen. This is not 7, 8 years ago when I became AG and started suing the Trump administration. They've learned. This is Trump 2.0. But then again, I think everyone else has learned it some as well. I've had conversations with Attorney General Bonta, who came in after I left, about this. Look, we just got word that another one of the Trump executive orders got enjoined by a court again. So if it smells like it's illegal, if it tastes like it's wrong, if it looks like it's not right, chances are it's not. And as I said, so long as our judges and our generals do their job, our democracy holds. The moment our judges and generals start to believe they report to Donald Trump and not the Constitution, then let's talk.
Great. Thank you so much. We now want to open it up to the audience. I'm sure there's many questions you have for Secretary Becerra. So if you have a question, please raise your hand and I'll call on you.
And if they give me their name.
Yeah, let's give your name and maybe your year. Yeah. Let's go right in front.
Hi, Mr. Secretary. I'm Ramon, and I actually am one of the advisors for the Director General of the WHO. And I actually skipped new student orientation to see you last year at PAHO's Directing Council. And I guess I'd love to hear some of your thoughts on the recent withdrawals of the US and Argentina from the WHO and Elon Musk's dismantling of the Global Health Bureau of USAID, and how you think this might impact global health efforts and the US's soft power, especially around the pandemic treaty.
Did everyone hear? That's about the U.S.'s withdrawal from the World Health Organization and what that means, the implications of it. My first trip, still during COVID, I can't tell you how many people came to us and said, "So great to have you back, but will you stay?" The U.S. really does move the world. We sort of know that. We very much take it for granted. People, to some degree, get frustrated, dislike that we take it for granted that we're so important to the world. But they appreciate us. And they will take us even though sometimes we're ignorant of the fact that we move everything. Because if we're not there, it makes it tough for everybody else because no one puts in the kind of commitment that the U.S. does. To withdraw from the WHO, it will have an impact. It will have an impact because everything now slows down. Because we make it possible for a lot of the work that goes on, especially places like Africa, in some of the East Asian countries, pockets of Latin America, we make it Eastern Europe, we make it possible for them to move forward. Ebola is under control because of what we did, working with WHO and the host nations. But without us, there's not the capacity. And so to withdraw, it's a sin. It's more than a sin. But you'll find that out because diseases don't stay within borders as we define them. They'll come over here. And because it is so easy now, not only to exchange data and information electronically, but for people to travel. People are traveling all the time. That disease, that virus will come to America. We won't be able to stop it. It will come. So it's short-sighted. I don't think it'll last. Again, it's the bark. I hope in this case they realize that they're biting themselves in the behind by doing this. But we'll see. Oh, here.
Hi, Secretary. Thanks for being here. I saw that.
Your name?
My name is David. I'm at 3 Law School.
Amen.
I saw that Rob Bonta has sort of pulled back on his plans to run for governor, and he credited the fact that he expects Vice President Harris to run and clear the field. Is that your expectation as well?
Of having Vice President Harris run, or
and also, will she clear the field? Will she get if she were to run, would Lieutenant Governor Kudalakis step out?
Yeah, I'm not sure what her intentions will be. I can guarantee you it won't clear the field. It'll be an interesting race. Stay tuned.
Right there. Yeah.
Thank you so much, Mr. Secretary, for your time today. I'm curious,
Your name?
my name is Melina Kapoor, and I'm a senior here. Your most recent role was at HHS, but you've also held elected office and run your own campaign. So I'm curious, in light of the recent election, whether you have any reflections on what the campaign and the party did wrong, what mistakes were made, and how you think about the next generation of Democratic leadership.
You know, I did get involved in the election. Later on, we were elected. It's tough when you're an administration official, especially in the cabinet. You're very constrained. The Hatch Act really restricts what I can do. I could go campaign for the ticket. I just couldn't mention what I did, which is really awkward to be up there and say, "Hi, my name's Xavier Becerra," and I'm like Voldemort. I can't tell you who I am. So it was kind of awkward. But what I will tell you is this, and I speak now as a Democrat, because you asked. I think people, how can I say this? People have lost confidence in politics and the people in it, politicians, because I don't think they feel the authenticity. And they think you're looking right around them at the next person after they finish with you. And what they're trying to communicate to you is, hey, I can't afford a house if I had to pay 7% interest on a mortgage. Hey, I can only afford to buy 1 dozen eggs now, and I really need more than that. And that they're looking right around them. And my sense is that I think on the Democratic side, we felt so empowered by having a chance in 2020 to move an agenda. And we did, as I mentioned, never before have we seen so many Americans now with health insurance coverage and so forth. But we lost sight that some people are saying, wait a minute, I already have health insurance, but I can't afford those eggs. And I think that disconnect is what hurt the party. I think the values are right on. It just be more authentic in when you communicate them. I mean, I'm getting to do things, Carolina, both of us are getting to do things we never could have expected. My parents never got to step in a college classroom. It's all great. Everyone asked me, gosh, the troubled world, this country, terrible. I said, you know what? It's a great place. The glass is half full because this is my first time getting to do this stuff. And so to me, sky's the limit. Just let them know what's in the sky so they know they can reach it too.
Great.
Spread around to the, yeah.
Right down there. Yeah.
Thank you so much, Secretary Becerra, for being here again. I was listening to you the last time you came, and I'm always so impressed with what you have to say and your experience.
Thank you. And you may want to speak nice and loud so everyone can hear you.
Okay, my name is Linda, and it looks like I'm probably the older adult in the room, and I'm really glad that I am, because many of us cannot understand how an unelected person, such as Musk, can come in, raise his hand, and say, stop U.S. aid. Especially when he's saying there's something like 57,000, and yet he's asking for another couple billion for his businesses. And we know that it already has affected many children, are already starving. The medications are being expired. Food is rotting. What is wrong with our Republican congressmen and senators that they cannot stand up to this person other than for power and money?
So I'm not going to try to read the minds of others. I will say that the Republican Party of today, and I'm not Republican, so I won't try to speak for the party, but the Republican Party of today is not the Republican Party I knew, that I fought with, that I went out and had beers with way back when I first got into politics in the early 90s. Newt Gingrich, who became Speaker, I got to Congress, as I think Colin mentioned, I got elected in 1992. So in 93, Democrats had the House, the Senate, and Bill Clinton was president. 1994, Republicans swept the House. Newt Gingrich became the Speaker. A lot of us as Democrats said, oh my gosh, Newt Gingrich is Speaker? Newt Gingrich couldn't get elected leadership today in the House of Representatives. It's a very different party. In those days, the party was all about trade, removing tariffs. Now you got their standard bearer who's talking about tariffs on everything that you can think about. It's just a different party. So I won't try to speak for them, but what I will tell you is this. At the end of the day, whether you're a member of Congress or a member of the executive branch, your obligation is to the laws and the Constitution of the United States. Elon Musk, can he do what he's doing? I don't think he can, but until a court says otherwise, I suspect they're going to try to do as much as they can. But he's not elected. He perhaps has a special employee category that may let him have access to some things. But my understanding is, from what I've seen in the news, the way you have, he's having access to information that's restricted from folks who don't have the correct authorization. But we'll see. Again, that's going to get tested in the courts. Judges and generals. Judges and generals. The back of our democracy is now counting on the judges and generals.
Great. Oh, it's right there.
Hi, my name is Bella Meyer, and I'm in first year. My question for you is there, if any, health issue in the United States that you believe has not garnered enough attention or discourse by the public, and why do you think that is?
Gosh. We do a pretty good job because we've got so many talented people who are really researching a lot of this, that we touch a lot of the different conditions that really impact the lives, not just Americans, but beyond. I would say we don't do as good a job, because there's not a lot of money in it, in doing the preventative stuff. That people are still dying of malaria is crazy. That people are dying because they're drinking unclean water is tragic. We could certainly do a lot more to help prevent death, but it's not happening so much here, so we don't invest in it so much. I will give you a couple of examples of things that I hope we will do more of. We're on the cusp of actually finding a cure to sickle cell. And the problem, of course, is that sickle cell only impacts a small minority of our population, probably a couple 100,000 people. But it is a painful, painful disease if you have sickle cell. And it is not only debilitating, but it probably will lead to an earlier death than you should. We now perhaps have a cure. It's going to cost about $1 million per person. So we came up with a program so we could make that available to those folks, because most of those folks don't have the money to pay for their condition, the treatment of their condition. Not the cure, but the treatment. And they end up on Medicaid, which is Medi-Cal in California. And guess what? That means taxpayers are paying for the bulk of the cost of those who have sickle cell disease to get the treatment they need, just to keep them from having excruciating pain and to be able to live a life. So we went to the states and said, because Medicaid is a federal state program, we pay essentially a little bit more than half, and the states pay the rest. And that's how we keep the partnership going. We went to the states and said, look, sign up with us. Let's have a subscription kind of program. Sign up with us. Let us negotiate for all you states with the manufacturer of these new curative treatments a price. It'll still be very expensive, but we'll bring it down from $1 million because we'll guarantee them a lot of customers. Without doing this, virtually no one will buy that treatment because they can't afford $1 million a hit. But if we do it together, we can get it to a big population. And so that was underway. I got word that the Trump administration has now canceled that, which means a lot of these folks can see the treatment within their reach, but may never get to grab it. Another thing, hepatitis B, we're trying to Is it B or C? Hepatitis, the one that we cure it's C. Yeah, hepatitis C. We have a great program. Again, there's a little bit larger population of folks who have hep C. But we know that in this case, we do have a curative treatment. And the cost of hep C, if you don't get cured for the time when you live, is extremely expensive. So Dr. Francis Collins, who used to run the NIH, went to the administration and said, for about $6 billion, we could cure Americans of hep C. And the Congressional Budget Office, that's the scorekeeper for the cost of legislation that Congress proposes, has scored that that's going to actually save money, because over the 10-year window, it would cost more just to treat those folks who have hep C than the $6 billion. So why not make that available to everybody who knows it's a finite population, make it available to everybody. That was in our budget. It didn't get included in the round of negotiation in Congress. So there are things that we can do where we could reach more people, but it's not necessarily always in our interest because we don't suffer those conditions as much as they do around the world, or we're short-sighted and we don't invest in sickle cell or hep C. But for the most part, most people come to America to make sure they can get curative treatment.
Let's go right
You may want to start going way back there,
Yeah.
because I see some of those folks are being very patient.
Oh, I was right here. Yeah. Yeah.
Thank you for joining us, Mr. Secretary. I'm Langston. I'm a senior and a master's student in public policy. And right now I see a lot of darkness in the administration that's coming. Darkness that makes me kind of want to look for some hope. And one place I see that hope is state and local government for carrying forward some of the legacies of your administration. I'm curious where you find hope and what you think the role of state and local government has to be over the next 4 years.
I certainly find it in California. I think you all are going to take us out of this. You better, because you're going to be your world after we leave. And so it's in your interest to do things differently. Learn from this. This is a great experience. I always used to tell people, the greatest opportunity to change a mind is when there's complete chaos. Because in that moment of disorientation, you can lift up that scalp, stick something in it, and they won't have noticed. And that's when you can get this idea into their brain. And that's where we are right now. People are, many distressed, maybe are concerned. Again, forgive me for continuing to say it, if the judges and generals don't hold up, then be distressed. But if our judges do their job and our generals follow the Constitution, we'll be okay. This is a big country. It's a democracy that's lasted longer than many people expected, and it still thrives. There is no country in the world who comes close to us in having succeeded coming out of COVID and moving forward. And so you should be very hopeful. You're too young not to be hopeful, right? You're too young to be Republican too, so forgive me. I take it back. I'll reel it back. I'm in there. I was just kidding. But this is your time to be bold. Fall. I always tell people, you should be falling a whole lot, but be leaning forward when you fall. Because I always say, if you're leaning forward and you fall, when you get up, you're still further along than when you first fell. When you get up. And so just keep falling. Test yourself, learn, because this is a great moment to fall a whole bunch. Because, wow, what you're going to get out of this. I remember when Carolina, she's a high-risk OBGYN. She was at LA County USC Medical Center back in the 80s, 90s. At that point, anybody from LA? Okay, LA County USC Medical Center in the heart of East LA is the county hospital. In those days, it used to deliver, what were the numbers? 20,000. About 20,000 babies a year, which is, I forgot what percent.
1 in 200 in the country.
Yeah, 1 out of every 200 babies born in America was born at LA County USC Medical Center. I remember the stories. She'd come back as a resident from work. She'd tell me, well, we can't let the spouses and the partners come see the mother-to-be because we got women in the hallways. We're so crowded. And she was getting to do things that you don't get to do except in third world countries. So her training was way up here, ready for just about anything. By the way, again, teaching moment. And all of a sudden now, you've got a great physician who can do all sorts of things, because she went through hell. You get to go through hell. But man, is everyone going to look to you and say, so how did you do that? And you know what? Say, this is easy compared to what I went through. This is easy. And the country's better for it. So honestly, the places of hope, I got to be looking at it, because if you aren't the places of hope, how many of your peers are not? I know most of the folks that I hung around with when I was in high school are not in places like this. And so, please, we'll be good. Just be savvy. Don't take things for granted. You know, don't worry. Be ready. You know the song, Bobby McFerrin. I got a little song to sing. Don't worry, be happy. No, don't worry, be ready. Don't worry. Use your superpowers. Your superpowers is you know the law, you got trained. Don't worry. Get your rest, because you're going to be busy. Go way back.
Yeah, let's go.
I see this
right
young
there.
man over here. He's had his hand with green jacket. Green
Yeah,
jacket.
right there. Green jacket, blue shirt. Yeah.
Your name first.
Oh yeah, I'm Sebastian. I'm a first year, and so I read in the news a few days back that there's a report on avian flu spreading through cats that was redacted after being released, presumably at some personal request of a higher administration official. I read a bit of history, and there's a bit of notes on like the Great Flu pandemic after the First World War, and how one of the reasons why it was so bad was because information was censored to support the war and all the soldiers coming back and it being a happy time because the war was ending. And we saw it even back in the closing days of the last administration that many of the political, those in power in various, usually more Republican states, were very interested in trying to keep the pandemic on the down low or distract and sort of almost conceal it from the public because it would be a drag on the economy and a drag on the people as they saw it. And what do you think might be like the future of this sort of medical censorship to keep the people almost like sedated and not worrying in this, especially in the environment of this new administration with its decisions to punish people who don't go by the correct narrative and so on and so on?
Yeah, so I'm not familiar with the case of any censorship of medical information. I know that during our time, we did everything we could to put out all of the information we had, including information that sometimes didn't give you a clear signal of what to do. But we wanted people to see it because we wanted people to feed back their take on it so we could start to get a sense of where to go on some of this stuff. You know, we didn't know where COVID was going for quite many, many months. First under the previous administration, and even under the Biden administration, we were still learning in January 2021. We were still learning a whole lot. We were still trying to find out how effective the vaccine would be. We were still trying to see which of the vaccines, because we had about 3 or 4 of them out there made available, and whether they were more effective than some of the others. China had some, Russia had some, you know, everybody was out there. And so what you want to do is get information out there. That's the best part of this electronic information age, is you can get so much information. The terrible part is when they start giving you mis and disinformation. That's not true about stuff. So what I would tell you is this: censorship should be a bad word for everyone, because as tough as it is, and it was really tough for me as secretary to combat the mis and disinformation. I don't get a budget to do marketing. It's still better to have information out there, because at the end of the day, the facts will take you places. And today, if you look at who's dying from COVID, there's still people dying from COVID. It's principally people who haven't kept up on their vaccines or who never got vaccinated. Yeah, they're probably older or more infirm and therefore have lower immunity levels, but still, the facts show that the vaccine is more likely to keep you alive and out of the hospital than if you don't do it. Now, what some people will say is, wait a minute, there are different ways. You don't have to take a vaccine to be safe. If you get ill and survive, you've now got immunity, natural immunity. That might be better than the vaccine itself. Very true. Some people are saying, let's let everybody get sick, so this way we have herd immunity. Yeah, I mean, ultimately that's what you do, is you want the population to all have their own immunity. The difficulty with that approach is a whole bunch of your grandparents are going to die, or your sibling or your parent who has some condition, cancer, or for whatever reasons it has lower immunity levels, they're going to probably perish because they can't withstand that new virus coming at them. And so there are different ways to do this. If you're really healthy, it's like the guys that think they can ride motorcycles and not wear a helmet. You know, they're pretty fit. They know how to drive a motorcycle. Yeah, I'm not going to get hurt till you do, and then it's on the taxpayers to pay for your brain injury costs. And so there are ways of doing it. At the end, I will bank on the science and the facts.
Right there. Yes.
Hi, Secretary Becerra. Thank you so much for taking the time to speak with us. Your humility and I think your optimism is something that I think everyone needed to hear. I was just curious. I'm a first-year medical student. My name is Hannah, sitting with my school peers here as well. I'm curious if you've ever consulted your Dr. Reyes's perspective on healthcare issues, as she's a physician, and kind of what your, especially with the policies that have been passed recently with ICE being able to raid hospitals, proposed CMS cuts. What do you think the role of the physician is in not only taking care of the patient, but also about thinking about advocacy and what we can do as medical students as well as future healthcare professionals?
Give me your name again.
Hannah.
Hannah? I have to say thank you, Hannah, because you're going to give me a chance to score some points and say some nice things about my wife. So it's, first, I rely on her more than she thinks, because it's not that I will go to her or we're in bed and I'll say, hey, we're trying to figure out if this COVID vaccine is going to be effective. What do you think? Or, you know, it's more watching and listening. And I will tell you, it goes well beyond medicine. Probably the thing that I love the most about Carolina is that she really does care. And I think it's because of the way she was brought up by her family. She's one of 8 kids, and I got to tell you the story, because to me it just shows who she is. When her father and mother passed, and her dad had been convalescing for many, many years, they never once left the house to go to a nursing home or anything. They got taken care of at home. He was down for about 4 or 5 years, immobile. Never once had to go anywhere. Died there at home. Her mom died at home. The last days that she was going, it was like a party. The extended family, including the great-grandkids, were coming through. Everyone was saying goodbye to her. I remember watching that and saying, when my parents go, this is the way we're going to do it. Because it was showing that the best care wasn't the medicine and the science. It was just being with the people who loved you most. And I don't know if you've ever been sued. I go around, I hope you haven't, because that's what I go. I go around telling people, my wife is a high-risk OBGYN. OBGYNs have some of the highest insurance rates, medical malpractice insurance rates in the country. A high-risk OBGYN, you can imagine what it costs. Never been sued. Never been sued. So she's good. And I get a lot from her, but not so much just on the science. It's just how to handle health and how to treat the health. And so this is what I say to you and your colleagues who are going to be critical player. You are going to be respected more than just about anybody else. People will, their jaws will drop when you speak. You are E.F. Oh, you guys are too young to. E.F. Hunton. When E.F. Hunton speaks, people listen. They have these great commercials. When E.F. Hunton, somebody who worked for E.F., it's a financial firm. When E.F. Hunton would talk, everybody, because it was good financial advice. So you guys are like E.F. Hunton. When you speak, people are going to listen. How many people do you know? My dad was going through congestive heart failure. He'd go to his doctor, and his doctor would say, "Hey, so Manuel, how you doing today?" "Oh, I'm fine. So do you need anything?" "No, I'm fine. His legs are swollen, and but he's fine. Because he was just happy he got to see a doctor. Because when he was growing up, there was no way you get to go see a doctor. And so, and if they said, "Oh man, you better rest," that's all it took. So you guys are going to be very powerful. And you need to stand up to some of those voices in your profession that are peddling their opinions, not science. And so I don't jeopardize your career. It's like artists and actors who don't want to get into politics. They think it'll jeopardize their career. You got to do what you got to do. But you're going to be very powerful. People still trust, probably more than clergy. Well, maybe not my mom. My mom is Catholic and probably still a priest, but you guys have such power. And so take advantage, but always treat people as if they're your family, because that's authentic. That's authentic. Right there.
Hi, I'm Anna Roth. I'm a freshman here, and I have a question about your role as a congressman. And I saw that you changed districts pretty often, or you changed districts a couple times. Could you explain why you there, how that really happened? That's really interesting. Yeah,
Emma, it wasn't that I changed districts, it's that my districts changed on me because of redistricting. So it really was just the number would change. I essentially stayed pretty much in the same place. The district might get configured a little differently, but all those years that I was in LA, representing LA in Congress, I lived in one place, Eagle Rock, and the district kept changing shape and changing numbers, but I never went hunting for another district. It was essentially the same district with, different communities. Yeah.
Great. How about, yeah.
Colin, what power you have to.
It's very difficult. I hope I'm not upsetting anybody.
Hello again, Secretary. Thank you so much.
Give us your name.
My name's Ho Yoon. I'm one of the freshmen here as well.
And Ho Yoon, nice and loud so everyone in the back can hear you.
All right. Well, you just described yourself as outgone in your talk. And from Stanford all the way to Washington, D.C., you seem to be quite the trailblazer. And I was wondering about what your next plans were. And to maybe add on to that, what's one new change you've seen in your life after your life out of office?
For the first time, and I'm in my mid-60s now, I'm unemployed. It doesn't feel too bad, actually. It won't last. I'm actually having conversations with Stanford on some things and a few other places. And I might actually decide to jump into some other stuff as well. So I'll stay busy, but what's changing? It's a different politics. I don't know, forgive me. See, this is what happens when you've been around a long time and you've got all these experiences. That's why I keep telling you, this is going to be a great window for you to really explore, because later on, you're going to be using these examples. I remember in 2025, blah, 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 and then we say, wow, she's so prescient, and wow, he hit it right on the mark. Dukakis, Bush campaign. Willie Horton commercial. Anybody remember a Willie Horton commercial? Yeah. Willie Horton commercial was, you guys weren't even born. Your parents may not have even been born by then. But Willie Horton, this is 1988. George Bush Sr. ran a commercial against Michael Dukakis, the governor of Massachusetts, that talked about crime and how Dukakis had, I don't know if it was pardoned or he had allowed, there was a program of early release of felons who had served some time. One of them was a guy named Willie Horton, who happened to be black. And everybody in America got to know who Willie Horton was, because Willie Horton became the face of Michael Dukakis and what would happen if you became president and allowed felons to go out, because Willie Horton went out and apparently committed a crime. I think he raped or he killed someone. And so he got painted with Willie Horton. That was intense back then, intense. That's like apple pie today, what goes on. These deep fakes and all the rest. It's just a different, different world. And you guys are going to have to discern. And it's going to be so important because you all are educated. Think about the folks who have 2 jobs, got kids at home, aren't sure if they got the money to pay the rent. They don't have time to sort of dig and find out what's true or not. And that's where you guys are going to really be so important. And especially if you're in a profession like the medicine, things have changed. But you know what? At the end of the day, that's our world. Let's learn to live with it. AI is coming. Generative AI. Let's figure it out because it's coming. We're not going to stop it. And so I think the most important thing I can tell you is accept change. Go understand it, write it, but stay authentic.
Great. We're going to take one more question. Let's go in the back, way back, right there. Yeah.
Hi, thank you for your talk. I'm Tenue, and I'm a sophomore studying computer science and economics. And one thing that I'm very interested in is in drug development. Today, sometimes the financing is the limitation more than the science. So in this world where in pharmaceutical development, the U.S. is a leading innovator in pharmaceutical drug design. So how do you expect the pharmaceutical funding models to change in the future, especially since the U.S. is a leading innovator, and one of the reasons why we're capable of this development is because we front a lot of the high drug prices, so other countries are able to negotiate down the prices.
Yeah, great question. Great way to end it too. But I'm going to need 30 minutes for this one, so no, I'm just kidding.
More than welcome.
So where do I start? We just negotiated for the first time in the history of the country to reduce drug prices because Congress finally gave us the ability to do that for Medicare beneficiaries. Can you believe it? We've got 67 million people captive within the Medicare program. Name a business, a company, for-profit company, who would not like to have the business of 67 million people. They get that business, and they get it at the price that they want to set. Until last year, a pharmaceutical company would tell Medicare, this is the drug that your folks need on Medicare, and this is the price. And we could say no. And if FDA said it's a safe and effective drug and it should be on the market, and then if the Medicare program at CMS, the Centers for Medicare and Medicare Services, that goes through this process to determine whether that treatment or medicine is reasonable and necessary, that's the standard, then it gets included. And at that point, if it's in Medicare program, and whatever they said the price was, I was going to say you and me, because you're taxpayers, we have to pay through the Medicare program. And so today, we pay sometimes 2, 3 times, 8, 9, 10 times the price for medicines than what other countries pay, other people pay, for the same exact medicine. We negotiated last year for the first time because Congress gave us in the Inflation Reduction Act the authority to negotiate prices. First on 10 drugs. This year, it will be 15 drugs. And we were able to lower the price as a result of those negotiations by up to 80%. I guarantee you take a look at the stock value of the companies there were actually 9 companies with 10 drugs. They're still doing well. And they negotiated prices that are way lower than what they were selling those drugs to us. January 2026, those new prices kick in. We can still lower them more because the prices I negotiated are still 2, 3, 4, 5 times higher than the prices in other parts of the world. We are the piggy bank for the industry. And there is some truth to the fact that if we all of a sudden were to go down to the price levels that we see in other parts of the world, a lot of those pharmaceuticals would have a harder time because they rely on the sustenance that comes from their blockbuster drugs to help them do the research and discovery in a whole lot of other drugs that fail. It's like Hollywood. Not every movie is a blockbuster. And they need the blockbusters to help finance the movies that you end up not seeing. And so we could figure this out. We ended up, even though all 9 of those companies that have owned those 10 drugs sued me to stop me from negotiating, they all still sat down and negotiated. And so we can do this, do it better. They can still be profitable. We want them to continue to be innovative in America. And we'll see this next round because we put a great template there for this next administration to negotiate these drugs. The companies have until the end of February, I believe, to decide whether they're going to engage in negotiations on the 15 drugs we've identified, which includes drugs like Ozempic, which have become very well known. And we'll see. But there is no reason why American taxpayers and Medicare beneficiaries should have to spend so much money for some of these medications that are very important. But no doubt, we want them available to us. And we want to keep that thriving industry as much as we can in America. Great question. Thank you for that.
Great. Thank you, everyone, for coming today. And thank you, Secretary Becerra, for joining us. We greatly appreciate your time in supporting the Stanford Political Union's mission to foster constructive dialogue on campus, which is so important in this era. So thank you very much, and thank you everyone for coming.
Thanks for coming in the rain.